So he had some funny thing happening in his head. I always observe how the patients come, what happens to them, etc. No treatment. And he was the best friend of the then Chief Minister of Kerala. I say, what did you do, doctor? My patient is all right. Now future is for mind medicine, not mind-body medicine. Mind is body, body is mind. So every doctor must be a good psychologist. You must understand human psychology. Most of the time, I'll give you an example. I was a young doctor. I did it as a bloody fool, but in retrospect, I think that was the right thing I did. One patient was brought to me, a very rich man. In that part of the world, he was the richest man. He had some name, X name, let us say. We'll not name him because it's ethically not correct. He's no more there. So he had some funny thing happening in his head. And those days, I'm talking of the 60s, Vellore was the mecca of medicine in India. So he had gone to Vellore, spent about 8 lakhs in this big fight. But he was not all right. So he came to me. I always observe how the patients come, what happens to them, etc. So I said, then he said, no, he was a Malayan. He said, you would have a report on all the reports are here. Tell me what's wrong with me and give me some treatment. Then I said, no, report na treatment I'm not treating the reports, I'll treat the human being. What's your problem? Oh, me. There are 4 people there saying, what happened to his hand? 4 people describing. There is a what happened in his head, another 4 people will describe. There are about 20 people with his wife and children and all. Here 4 wives and about 20 children. The drama went on for about half an hour and my other patients were waiting. Then I said, that is, I told him, we'll do a contract. Only 2 of us. Rest of them will go out for temporary. So when they went out, I asked him one question. How did it start? Some peculiar disease. It doesn't fit into the textbook picture. He brightened up. He said, nobody asked me this question before. When I went there, they started investigating and testing. I know when it came. I said, when, he is a coup contractor. There's cutting the forest. You take 100 acres of forest for cutting and 10,000 acres you cut. This is what he was doing. So that itself will make him unhappy anyway. But here was it. He thought he was sitting in the forest, the dense forest, Western Ghat forest. And one day that small bee, doing it comes. And it was coming near, doing, and it was not going at all. It was doing not bumblebee, that not the big one. This is doing like that. I was worrying and coming here. And then he thought it had entered his ear. But it never came out. So he thought that had entered into the brain and sitting there and producing all these problems. So I said, Pakra ko pakra. So I told him, that's all. I will set it right. You stay here for a day. So I admitted, he told the nurse tomorrow morning, prepare the theatre ready, gown and all, the darkness, etc., light on the head and a torch and some salt. And get hold of a bee, kill it and put it in the kidney tray. So the man was very expectant at what's happening next day. We took him to the theatre, etc. To cut the long story short, I showed him the bee. It has come out. He lived another 50 years and died at the age of 89. No treatment. And he was the best friend of the then Chief Minister of Kerala. And Karunakaran used to always call me and say, what did you do, doctor? My patient is all right. See, this happens. The mind is the most important thing, not the body. If the patient believes something, don't insult him and say, hey, bee can't enter into your ear. There's an eardrum. But we don't know the eardrum can have a hole. No, but then there's stapes incus malleus and a middle ear, then this can't go to the brain. So argue with him. He is a crude wood cutter. No, never do that. That's communication is the most important thing for a doctor. What is communication? Understanding the listener and trying to be understood by the listener. Did you understand? That's communication. What we do is, I come here and tell you all about cholesterol that I have read from the book. You will be very impressed. Cholesterol ke baare mein pura bataya. But nothing has gone into your head. It has gone by the side or above or below, but not into it. So I must know what you can understand and come down to that level and talk. That's called communication. There's a book of mine called Fine Art of Communication. And this is a book, one industrialist bought 5,000 copies. I don't make money, Bharati Vidya Bhavan makes money, it's charity. They were very happy, they printed it again for me. Now, what I am trying to tell you at the end of the day is, because Divelera said, if you want to sell a new point to the audience, you have to tell them what you're going to tell them. I told you in the beginning. Then you have to tell them, which I've been telling. Then tell them what you told them. Now I'm going to tell you what I told you. And that is, human body is human mind. Everything happens in the mind. Disease is dis-ease and body suffers. And all that you have to do is reverse the whole process. Follow nature. And don't unnecessarily poison your body with drugs. But drugs sometimes are absolutely necessary. Like for example, I was in Qatar about 3 months ago. When I landed in Qatar airport, I started shivering so much, then I thought the airport was cool. Then I went to the hotel was cool. I was shivering so much that every muscle was aching. So I probably knew that maybe my temperature went up, I thought malaria, but I had to give 4 lectures in 4 days and they had spent so much money on me. So I used to take a shower in the morning, shiver and go to the lecture hall, and when I stand to lecture, the shivering stops. And then come back and do the same thing, and 4th day I was down, but it was malaria. You have to take treatment. But then that treatment is only for a short period. But there are people who give you lifelong treatment. That's very dangerous. 1 day, 2 days is all right. Even poison is all right. If you get a heart attack and come to me, do you know what I give you? Rat poison. Warfarin is rat poison. Same thing, you kill the rat in the house. Small dose I give you to keep your blood fluid. That's all. So even poison is not bad. He said poison is somebody's food and food is somebody's poison. That's kind of a thing. It's all true, literally. So use as little medicine as possible, but see doctors even with the slightest symptom. When you don't have a symptom, don't see nobody because your immune system is trying to do that. When you are well, asking for help, don't go to a doctor. When you are okay, don't go to the judge and say, give me justice. And when you are okay in the society, don't go tell the police, preserve my honor. They will kick you. So when you are not well, go to the doctor. When your honor is dishonored, go to the police. When your injustice is done, go to the court. So we must see a doctor. You must have a doctor. Everyone must have a doctor. He must be a family doctor. He must be a friend, philosopher and guide. To cure rarely, comfort mostly, but console always. So he must know you, your background, your worries, your anxieties, your economic status, your wife, your husband, your neighbors, your enemies, your friends, your status, everything you must know. In fact, you will be surprised. If you lose the love of your fellow men in society and feel you are not lost, you get all kinds of diseases because the immune system completely gets stopped. Even common cold, they found social support gone, common cold comes very easy.